All right, I'm going to show you how to properly mix glass ionomer cement. And for today's example, we'll use the Fuji Triage, which is a low viscosity glass ionomer cement. So just briefly, to prep the tooth before you place the material, it should be clean. So I like to use a little tufted end brush and some plain pumice to clean out the grooves. I have other videos that shows you this live on actual human teeth, so you can always watch that, but this is just for demonstration of showing the mixing of the cement, since you weren't able to see that since it was off camera. And then I try whenever possible to use the polyacrylic acid cavity conditioner when I'm placing a glass ionomer cement sealant or restorative. So this is what it looks like, and you just paint it on for 10 seconds and then you rinse it off. Okay, and then you do want to isolate the tooth. It should be moist, but you don't want it in a pool of saliva, but you also don't want it super dry because it does need moisture to set. So now we're ready to go ahead and mix our cement. So you're going to go ahead and open the package. And the Triage has this little pink button on the end. The different lines of glass ionomer have a different look, like the Equia Forte is red on the end. But this is what it looks like. So the first thing you should do is tap it on its side to help loosen the particles inside the capsule. And then you're going to push the button in, boop, like that. See how it's still sticking out a little bit? So then the next step that you have to do is you're going to take the applicator gun and you're going to place the capsule in the gun and you're going to give it one click, and you'll see that well, I guess I have to click it twice because that just engaged it, but click it so that it pushes the button. See how it's still sticking out? So one click and now it's plunged in there, so it's good. And then you press this to release it. Okay, so now you can take it out. Ta-da. So our clever trick is we have our triturator hidden in the drawer, because some people will complain, well, I don't have the counter space, or I don't want all the clutter, or I don't like the noise. So a trick for that is, well, put it down in a drawer. So here it is. We're going to open our little drawer. It's cool because we keep all of our equipment in there, or supplies I should say, in the drawer. And see how it's set to 10 seconds. So you're going to go ahead and place it in there. And you're going to start it. I can close the door so it's quieter. And as soon as I take it out, I'm going to set our timer for 2 minutes and 30 seconds. That's our working time. Okay, so I'm going to go ahead and start that. Let's take this out. Okay, you're going to place it in the gun. And you're going to have to click it a few times to get it going. And your assistant can do this. But don't press, especially the low viscosity, don't press it too far because it's pretty runny and it'll start coming out. See how it started to come out a little bit, and then you're going to come over to the tooth. I do like to use the gun to squirt it directly into the tooth, but you could also put it on your finger and spread it onto the tooth. So there it is. I can demonstrate that too. You could put some on your finger. Let's say the kid is real fearful. You could do that. And just press it in with your finger, like so. And then I like to take a damp Q-tip and just press it into place. You have, depending on the humidity, you have about 1 minute and 15 seconds of working time. I'm in Arizona, so it's super dry, so it's more like 45 seconds. But you want to just get it into place, get off any excess, and then you want to leave it alone because you don't want to over manipulate it. Okay, all right. Now we wait. So when it's set, or I should say when it's setting, if it does look dried out, you could touch it with a Q-tip to moisten it a little bit. And when it's all done, I like to cover it with something to help keep the saliva out a little longer. So you could just use Vaseline and wipe a little bit over the surface. Often the kids are getting the sealants done at their cleaning or routine exam. So we're doing a varnish treatment anyway, so you can apply varnish over the set glass ionomer cement. I like to use the Floramax varnish from Elevate Oral Care. This is nice and cost effective because it comes in a bottle. Just shake it, put your little drop in your dappen dish, and then you can place it over the top. So we still have 25 seconds left. So maybe zoom in a little or come a little closer and you can see how it looks. Okay, and I'm going to get my varnish ready just to protect it. So that's our 2.5 minutes. I cover it. Awesome. Okay, so it's super easy. And then the last thing I like to do is instruct the patient. If it's a child, of course, I also have to tell the parent, but to eat soft foods, ideally for 48 hours. I don't want them to go and eat something super hard and crunchy like nuts right away, because this is still going to take time to reach its maximum strength. So we created this little instruction post-op sheet for glass ionomer cement with those instructions along with some suggested softer foods. So you can make something like this if you like to hand out just as a reminder. So kind of like when you do amalgam, so you would tell people to wait before they have something real hard to eat because it's still setting. All right, pretty easy. That is it.